Welcome to On Deck at CHCF, a new series of healthcare conversations held on the deck at the California Healthcare Foundation. I'm here today with Ed O'Neill. Welcome, Ed.
Good to be here.
Ed, you have a long experience studying workforce issues, and we have a new package of almanac releases about healthcare. We produced an infographic that compares some healthcare demographics in San Joaquin Valley as well as the Bay Area.
The side-by-side comparison of Bay Area and the Valley is interesting because it reflects the discontinuity that's existed for a long time. There's a gap in terms of nurses and physicians to population, higher concentration in the Bay Area, fewer out in the Valley. It does beg a question, though, when you see a disparity like that. I think the first impulse for people is to say, oh, we have to get the Valley up to be the same as the Bay Area, but that just doesn't necessarily follow. I mean, the reality is we don't really have a definitive notion about what's the right number. We probably have an idea of a band, and both of those numbers are within the band of the professionals to population. And then you have to ask yourself some questions: is having too many professions, does that actually skew the labor market in a way that you perhaps don't want it to be skewed? Or is it so low in the Valley that it's endangering folks' health?
Sort of healthcare is local, and the local solution to your problem is probably going to be the one that's going to help fix that problem in the long term, because they understand what they need better.
Understand what they need better, can fix it in an appropriate way, and probably fix it in a better way than trying to change the whole system. For several years out on the hustings giving my workforce talk, I had a slide that showed the population to physician ratio for Connecticut, for the whole state, and for Iowa. And Connecticut had, adjusted by population, twice as many physicians as Iowa. But now when I looked at the overall health of the two states, of Connecticut and Iowa, I couldn't see for the life of me any difference in the health of, I think they're called Hawkeyes, or Yankees in Connecticut. I mean, it was essentially the same, but a vast difference in the availability of physicians. And there's obviously a lot of concern now that with the ACA that we won't have enough primary care providers, probably some concern about some subspecialty providers. But I have a sneaking suspicion that 5-10 years from now, as that, we'll talk some about this later I think, but as the health system changes the way it produces a unit of care, day stay in the hospital, outpatient surgery, a visit to a primary care provider, as those production functions change, we may find that we actually have more than enough.
It's also, it's about having the patients have some locus of control as opposed to everything being driven by what's convenient for the doctor.
And that's really been, I mean, not to demean the health professionals, but that's really, the system's been set up for what's convenient and easy and comfortable and profitable for the provider.
Things have been changing for a while for health professionals, and what's gonna happen with the ACA? How is that gonna shift it into overdrive?
All four dimensions of healthcare: prevention, diagnosis, treatment, and management. We're going to see new entries into that, providing some proxy service that now the ACA will make possible. So the ACA is opening the way for these innovations to come about.
So would you say sort of one of the headlines of this would be, professionals are being forced to change, and maybe consumers / patients / families are going to see things get a little bit better, a little bit more on their terms than they have been in the past?
Well, I do think that the great opportunity for professionals, I try to get them to see, many of them think that this is the end of life as they know it. Right. And it is in many regards. If you didn't want anything to change, then this is not a good time for you. But if you say, well, we really could have done better, I was very dissatisfied with that, if you're a professional, now's the time for you to be innovative.
If you had the healthcare czar hat on, and we don't have one, but just imagine putting one on,
okay,
baseball cap or a Stetson. What are three things that you would recommend to keep this going, keep the momentum going?
The first thing is we need to make that innovation process go faster and deeper. The czar or Czarina could look at where we stop innovation. Second thing is, and this is for education, we need to expose our nursing students and medical students and dental students and pharmacy students and allied health professionals in training to those innovations early on. We don't need to train them in one way and then have to retrain them in the other way. We need to get a much tighter fit, and in a place like California we really could do that. And then the third thing is, we do such a great job in this state with technology and technological innovation. We need an advocate for pushing this to the consumer as rapidly as possible.
Very interesting conversation. Thank you for
it.
being our first guest here on the deck. It was a little chilly today, shivering, but definitely a great conversation, and thank you so much.
Enjoyed it. Okay. Good to see you, Steve.